Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Good morning, everyone. So, this is Dr. Jasjyot Kaur. I am practicing ENT surgeon and I practice in East Delhi. I have a clinic in Mayur Vihar Phase 1 as well as in Vasundhara Enclave by the name of Mahajan ENT Clinic, and I am attached to Max Hospital, Noida. So, I am here to discuss common symptoms and early warning signs related to vertigo. So many people who are later diagnosed with vertigo don't even realize what's happening at first. It may start with very small, easy to ignore symptoms like feeling slightly off balance, a brief sense that room is shifted, or a blocked feeling in the ear, or nausea without a clear reason. So, because these symptoms are very mild and vague, often people blame their bad habits like stress, fatigue, or a bad day. That's why early warning signs are often missed. So, welcome back to the Steady Balance episode 2. In this episode, we'll help you understand the early signs of vertigo, what patterns to look for, and when to seek help. So, many people expect vertigo to mean spinning, but it doesn't always start that. So, a patient all of the sudden can't feel spinning. So there are early symptoms like mild imbalance, brief tilting or shifting sensation, ear fullness, or unexplained nausea. These symptoms may come and go, so people often ignore them until they become more noticeable. Some people experience warning phases before vertigo become more obvious. So we as doctors call this as a prodrome phase. So, as vertigo becomes clearer, it usually follows certain patterns, and these patterns help us to identify the cause. So, one of the most common pattern is sudden spinning when the patient takes turning in the bed, or patient just looks upwards, or on bending down. So, this the spinning basically starts on the positional change. So, this spins usually starts within seconds of the change of the posture and lasts for less than 1 minute. This typical feature is of the condition called BPPV or benign paroxysmal positional vertigo, one of the most commonest cause of vertigo. Another pattern is longer lasting vertigo where lasts for hours instead of seconds. So in BPPV, it would be for fractions of seconds, like it may be for 5 to 6 seconds, and then the patient will feel normal. But in this, the vertigo lasts for hours. So these episodes include nausea, vomiting, difficulty walking. There may be tinnitus, that is ringing in ear, a blocked sensation in ear, and changes in hearing. So this pattern suggests Meniere's disease, which is also a disease related to inner ear. Now, some people notices vertigo after any viral illness such as cold or flu. If vertigo starts after an infection and lasts for hours or days, we suspect vestibular neuritis as inflammation of the balancing nerve, that is the vestibular nerve. Now, not all important symptoms feel like spinning. Nausea is very common during vertigo because brain receives conflicting signals about balance like motion sickness. So we as doctors may also look for abnormal eye movement, which is known as nystagmus, because this help us to determine whether the conflict is in brain or in the inner ear. Many people feel extremely tired after an episode. That's normal. Vertigo places stress on nervous system. Anxiety is also very common after repeated episodes. People avoid certain movements or feel worried about future attacks or feel uncomfortable in public spaces. So this is natural responses and it is a part of the overall condition. However, some people may also experience oscillopsia where the visual world seems to bounce or move during a head movement. So, before we finish, so these were the main symptoms which were related to vertigo and some major causes of vertigo which we have discussed. Now, before we finish, here are three key takeaway points. Vertigo can begin with subtle warning signs like imbalance, ear fullness, or nausea. The pattern of symptoms does matter. Short episodes, long episodes, or post infection dizziness all suggest three different causes as we have discussed. Symptoms like nausea, eye movement, fatigue, and anxiety are important, and so it is very important to share the full picture with your doctor. So, with this, we are ending our current session. Thank you for the patient hearing. Thanks a lot.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.